Hi, and welcome to Nurse on the Go videos. This episode, I'm going to talk about scar management post-surgery. So recently I've had an arm injury and I've had some arm surgery, and now that everything is healed and the wound's all healed up, the hand therapist put me on a scar management program. So it's designed to do a few things, because what a scar is basically a bunch of tissue that is gelled together, but not in a nice uniform way. It's like all mishmash, all mashed up. And what can happen, it can become sticky and stick different tendons and muscles together, or different parts of your skin, and clump them up, and there'll be all clumps and hard lumps under your scar. It does remodel over 6 months to 2 years, but there are some things you can do to help it, realign itself. Because just imagine like your muscle strands go in a straight line. Once you've cut through that muscle layer, and they grow back sort of crossways, so they can't move, so there's no movement there, they're all stuck. So we want to try and break that scar up, so when they grow back, they're sort of in more alignment, so we can get a good even coverage. So that's the aim. So the 4 things that we do to help improve scar management is, firstly, is scar massage. So we'll go through that. Secondly is we can do a bit of traction on the wound as well. Third thing is we can do compression, so we can put a compression device on if needed. And fourth thing is a new fancy, it's a silicone-based dressing that actually helps. So firstly, let's talk about the scar massage. So I'll just show you my scar here. So my scar is along here, and see it's lifted up a little bit. So what you do, you can either use cream on your finger, so if they just want it to slip around, if they don't want it to be too vigorous, depending on what wound you have, they'll say put cream on your finger to make it slippery. I'm not to use cream because they want me to get a bit more friction, so just so it does rub a bit harder to break up that clot. And all you do is just get your finger and gently press around the clot, the scar site, and just gently do little circle movements as much as you can tolerate. And I've got to do that probably 4 times a day. So I just do that around the wound. So ask your hand therapist how many times a day you're to do it, and they'll tell you. So that's how we do a bit of massage around the scar. Now there is another substance called Dicam, and that's a sort of non-slippery substance that you put underneath, and it stops the skin slipping, so you actually move the tendons and the scar underneath and slowly break that up. So you can use that as well. The next thing that we use is, not everyone gets it, depending on how the scar is formed and healing, because it is growing crossways, it does make the tendons shorter. So sometimes they'll put you in a brace or a splint to actually try and stretch it out. So instead of your hand being that way, they might stretch it back, depending where the wound is, and they might try and stretch the tendon so it can start growing in a nice straight even pattern. Another good thing that I'll be using, and it's overnight, I won't be doing it in a day, is having some even compression around the whole limb. So that can be TED stockings, so I'll be using TED stockings for that. Not TED stocking, get it right, a tubey grip. So I'll be getting a tubey grip and putting it over at night time. So that will put even compression through my arm and help bring down the scar tissue, make it shrink down a bit better. So I'll be doing that at night. Now fourthly, I did mention about a silicone dressing. So what a silicone dressing is, basically it doesn't actually stick to your skin. It actually, you'll sit there, but you can actually peel it off and it won't actually pull your skin off. It's pretty amazing stuff. And the one piece can last you, a couple of weeks, depends what you use. And you take it off, in the morning. So I'd have it on at night, take it off in the day, just because it's so hot up here in Queensland. And, you can get really hot and sweaty, so I just have it at night. But if you could leave it on all day, it is good to do. But when you take it off, just wash it in a bit of soapy water and just pat it dry with a non-linting cloth, because if you get lint on it, it won't, adhere to your skin. So you want something that's non-linting to dry it off. Leave it in, your bedside drawer or something, and when you're ready to put it on that night, put it on. Now, with the silicone dressings, do not put them over an open wound, or if you've got any pimples or any sores or anything developing, do not put it on. It's for totally healed wound that hasn't split open, because it does keep the area there moist. It can break down your scar if you've got an open area still. So, but your hand therapist or doctor will go through those sort of things with you. So that's our little video on scar management and how to try and decrease your size of your scar and improve your mobility with your tendons. And I hope that's been a bit of use for you. So thanks for watching Nurse on the Go videos. My name's Phil and I'm here to help you care. Bye bye for now.